Lifing Podcast, Episode 13, Healing from the Ground Up, Why Soil Health Matters for Human Health. Welcome back to the Lifing Podcast, where small shifts create brighter living. I'm Dr. Violet Hunter, functional medicine and primary care physician, entrepreneur, wife to a retired military service member, and mom of 2 little ones who make life full in all the best ways. Each week, you'll get one simple, grounded, science-backed practice you can weave into your world, whether you're juggling family, building a business, supporting your community, or just trying to breathe a little easier. Recently, I had the opportunity to participate in the Healing from the Ground Up Summit here in Iowa, where farmers, food system leaders, and healthcare professionals came together to talk about something that is rarely discussed together, the connection between soil health and human health. And I want to share some reflections from that experience with you today. Every day in my clinic, I care for patients living with chronic disease, stroke survivors, cancer patients, patients with type 2 diabetes, obesity, cardiovascular disease, autoimmune conditions, complex gut disorders. What strikes me most is this: most of what I treat is not a deficiency of medication. It's a deficiency of nourishment at the cellular level. Our bodies are incredibly resilient, but they depend on something fundamental, the quality of the food we eat. And that quality begins long before food reaches our plate. You cannot separate soil health from human health. The nutrients in our food do not magically appear in the grocery store. They begin in the soil, the microbial diversity in soil, the farming practices used, and environmental stewardship all determine the nutrient density of the food we eat. When soil becomes depleted, plants become less resilient. When plants are less nutrient dense, our microbiome suffers. And when the microbiome is disrupted, inflammation increases and chronic disease often follows. This is one of the reasons we are seeing so many metabolic and inflammatory conditions today. The health of our soil and the health of our bodies are deeply connected, yet our systems rarely treat them that way. Right now, healthcare, agriculture, and food systems largely operate in parallel instead of in partnership. Physicians are trained to treat disease once it develops. Farmers are often incentivized for yield and commodity production rather than nutrient density. Consumers are left navigating this with confusion about what healthy food even means anymore. But what became clear at the summit is that we are at an inflection point. People are beginning to recognize that food is not just calories or lifestyle advice. Food is biochemical information. Food is metabolic signaling. Food is immune modulation. Food is preventive medicine. If we begin aligning soil science, regenerative agriculture, healthcare systems, and community education, something powerful can happen. We can move from a reactive disease care model to a regenerative health model. In that future, imagine a future where farmers are not just food producers, they are partners in public health. A future where clinics work with local farms, food prescriptions become part of healthcare, and communities understand where their food comes from and why it matters. The future of medicine will not only exist in hospitals and clinics, it will exist in fields, soil, kitchens, and communities. Imagine an Iowa where soil health metrics matter as much as crop yield, where nutrient density is valued and measured, where chronic diseases like type 2 diabetes decline because we address the root causes upstream. Imagine children growing up understanding where their food comes from. Not just the grocery store, but the land itself. And imagine healthcare systems that focus more on prevention and partnership and less on crisis management. That future is not unrealistic. It is achievable, but it requires collaboration. The ground beneath our feet plays a larger role in human health than we often recognize. Healing truly can begin from the ground up. And if we begin connecting agriculture, medicine, and communities in new ways, we have an opportunity to regenerate both our soil and our health. Thank you for being here with me. I'm Dr. Violet Hunter, and this is the Lifing Podcast. Small shifts, brighter living. And sometimes the most important shift begins in the soil.